Three, two, one. We are live.
Good evening, everyone. I am Dr. Maunika, Regional Medical Advisor from Shield Healthcare. I welcome you all for today's session, SAFOG International Oration Webinar. And our topic would be Changing Landscape for Obstetrician and Gynecologists Stepping Up and Out. And I would like to welcome our MOCs, Dr. Niharika Malhotra ma'am and Dr. Umi Ruman ma'am. Dr. Niharika Malhotra, she is an MBBS, MD, gold medalist, DRM Germany, DMIS, FIC, MCH, FMAS, and fellowship in reproductive medicine, DGC. And she's a consultant in Rainbow IVF. She's a chairperson, Foxy Young Talent Promotion Committee. She's a joint secretary, Foxy 2018, assistant editorial, editor journal of IJHRRD. I welcome you, ma'am.
Thank you so much. Thank you.
And I would like to welcome Lieutenant Colonel Dr. Umi Ruman. She's an MBBS, FCPS, OBGYN. She's an infertility and ART specialist, Associate Professor, East-West Medical College at Dhaka, awarded Shan S. Ratnam Award by AOFOG on 2022, awarded OGSB Young Gynecologist National Award on 2017, has 21 publications, national and international journal. I would like to welcome you, ma'am, and I would like to hand over the session to MOC.
Thank you so much, Sahiti, and a very good evening, everyone, and welcome to the SAFOG International Orations, which are conducted every month. It is such an honor to have so many esteemed faculties with us today. As we know, SAFOG countries have a significant percentage of global population, and they still are contributing towards maternal death and NCDs. SAFOG is a huge organization which is now growing and has a definitive commitment towards women's health. And with these webinars, we tend to educate our doctors on current issues. Special thanks to Dr. Rohana for conducting these webinars regularly for our doctors and paramedics. I would now like to take pleasure in inviting Dr. Narendra Malhotra, Director of International Affairs of SAFOG, who is also the Managing Director of Global Rainbow Healthcare, past President of Foxy, Director ART Rainbow IVF, Director Foxy Smriti Manyata. He has been conducting a lot of events with Rotary District and also Director International Relationship SAFOG. We welcome you here, sir.
A very good evening to all of you and good morning to some people of the other world. And I see a lot of people from even from Ethiopia and other places have joined in. Welcome Dr. Abdul Fateh from the IAPM, the International Academy of Perinatal Medicine, and the Iron Donald School of Ultrasound, who have joined in with us for this international. So it's a real international. What you see participants here is only the faculty and the link, the other link we have on the YouTube and live on Facebook and recorded by Medisage, which will be with us as a permanent record on the SAFOG website. So going ahead with our series of orations, which we started, we are very, very fortunate that we have the President-elect of FIGO addressing us today on the changing trends, a very, very important topic. And I welcome Yvonne Diaz. Thank you for organizing and getting the President of FIGO for and Dr. Jaideep of the REI committee for getting the FIGO President-elect for us to address the SAFOG region. SAFOG region has its own problems and like a little bit of African region. And we need to discuss these problems and come out with it. So let's not waste time and hear what our FIGO incoming president has to say about the changing trends in obstetrics and gynecology. Thank you once again, everyone, for being here and making this webinar a great success.
Thank you so much, sir. And we would also like to take pleasure in inviting Dr. Rohana, sir, to give a few words. We know Dr. Rohana is the founder chairman of Nine Wells Care Mother and Baby Hospital. I have been conducting these webinars for the past 1 year under Dr. Rohana, and I've come to know him as the most humble person and very, very motivating and inspiring to all of us. Welcome here, sir, and we would like to take your blessings.
Thank you, Niharika, for that very kind words of introduction. Yes, we have been working together with Niharika for quite some time, and she has been moderating all our sessions so efficiently, and that they were very productive. So thank you, Niharika, for doing same this today also. So firstly, I have to congratulate and thank our international uh, Director International Affairs of Suffolk, Dr. Narendra Malhotra, who is a dynamic personality and has been really organizing so many uh, webinars and other scientific programs with international organizations during the last year as well as this year. So this year he has started on several orations. So this is, I think, the third or fourth oration which he is conducting. And I'm very happy to see the President-elect, Dr. Professor Anne Kihara, being the orator today. So I'm thankful to Professor Anne Kihara for, in spite of all these other activities, to join with Suffolk and give Suffolk the real assistance which is needed. And we are very happy that by these webinars and scientific programs, our two federations will come closer together. And today we are also having Dr. Yvonne Reyes from FIGO, and also our own Dr. Jaideep Malhotra, who is also the FIGO REI committee. So there is a real participation from FIGO in this Suffolk oration today. So I am also, I see that this topic today is changing landscape for the obstetrician and gynecologist, which is a very interesting topic. I think it will be a new topic, and we will all look forward to hear Professor John Kihara. And also I have seen Professor Arul Kumaran joining us in this program. So we're thankful that, and we are happy that Professor Arul Kumaran is also in the audience. So thank you very much for joining, and I won't take any more time because we have to listen to Professor Anne Kihara, and I will hand over back to our moderators. Thank you very much.
Thank you so much, sir. And I would now like to invite Dr. Ruman for conducting the session further and invite our chairpersons.
Thank you, Dr. Niharika. Thank you, everyone. Good evening, and greetings from Bangladesh. I'm honored and privileged to have sharing this outstanding platform of SAPOC International Oration Webinar 2023. Our today's session is chaired by two eminent, brain-powered, and diligent gynecologists, and who are continually working and contributing to improve womanhood and women's health in the whole world. First, we have Professor Yvonne Diaz Yamal, and who is gynecologist and obstetrician, specialist in human reproduction and gynecological endocrinology, René Descartes University, Paris, France, professor at Nueva Granada Military University. She is also the head of the Department of Obstetric Gynecology and Women Reproduction Hospital, Military, Central Bogota, Colombia. She is scientific director of the Medically Assisted Procreation Fertility Unit of the Marie Marle Clinic, past president of Colombian Federation of Obstetric and Gynecology Societies, chair of FIGO Reproductive Medicine and Endocrinology and Infertility Committee. Now we also have Professor Dr. Jaideep Malhotra. She is managing director of ART, Rainbow IVF, and chair of FIGO Reproductive Endocrinology and Infertility Committee, member of Accountability Group of PMNHCH, WHO, Vice President INSARG, past President Foxy, ISAR, Aspire, IMS, SAFOMS, and ISPAT, Editor-in-Chief of SAFOC and SAFOM Journal, and many other books. And besides this, she is a great teacher, great trainer, and great lady with a big heart who has fulfilled dream of becoming many of the young doctors like me to become an IVF specialist. Thank you, ma'am. Thank you. We are very much glad for having two of us among us, two of you among us. And so I'm welcoming you both to chair the session. Thank you, ma'am.
Thank you, Ume. Thank you so much. And a very good evening to all of you. Dear friends, I bring you greetings from Agra and from Figo and from Suffolk. It's such a pleasure for me to introduce the speaker of the day today. It's a very prestigious oration, and it's going to be delivered by none other than the President-elect of Figo, Dr. Anne Kihara. Anne has been a President Emeritus of the African Federation of Obstetricians and Gynecologists since 2020 to 2023. She's also been the past President of Kenyan Obstetrical and Gynecological Society and has been a consultant in Kenya from 1999. And as I know Anne, a very, very dynamic and a very vibrant personality. You fall in love with her right from the moment you start talking to her. She is really very vivacious and so full of energy. And her special interests in adolescent and youth health and leadership and advocacy are just phenomenal. Anne is also a very ardent researcher and is engaged in evidence-based practices, clinical care, policy in formulation and review, and a lot of strategic planning and guideline development and curricular development. She has more than 100 publications in peer-reviewed journals, and she is a true women's health advocate. And needless to say, she has received many awards and recognition all over the world. And this, being the president of Figo, is the biggest recognition I would say anybody could achieve. So the floor is all yours, and we are really looking forward to your perspective on the topic, which is a very, very important topic on changing landscape for the obstetricians and gynecologists.
Greetings. I'm really happy to be here with you this evening. I'm particularly participating in Suffolk International Oration Series 2023. My topic for the day, changing landscape for the obstetrician and gynecologist. Stepping up and stepping out. Pay attention. Normal deliveries are now being conducted increasingly by midwifery-led programs. Cesarean sections are being conducted by junior clinicians. Breast surgery is being performed by surgeons. Community health workers or community health promoters are providing contraception, point of care, screening for STIs, deworming programs, hemotinics, and even identifying our pregnant women and following them. Patients are undertaking self-care diagnostics. Pharmacies are prescribing medications off the counter. Technology is certainly taking over more and more of our functions through apps, ChatGPT, with information and even healthcare delivery. Advocacy in sexual reproductive health and rights is increasingly being led by civil society. This was a conversation I held with Professor Jadip Malhotra on the 11th of May in Cape Town, South Africa, as we waited for the shuttle to take us back to the airport. And thank you, Professor. You certainly gave me food for thought, which means what is the current role of the obstetrician and gynecologist in the context of today? And ladies and gentlemen, this is what has informed my stepping up and stepping out. We all believe we are at the pinnacle in women's health. In other words, putting it in my African context, we're the lions and the lionesses in the jungle. But are we really still there, or are we being overtaken by others? So having given you that background, what did I think of? How do we continue to roar as the main clinical provider of obstetrics and gynecology and in women's health, it certainly makes you think your mentality. And this is what crossed my mind. Are we being pushed out? Do we need to think seriously about task shifting and task sharing? Should we be accommodative for all these other people taking over what has been our pet peeve? Should we be adaptive? Or should we begin to have creative thinking? Or should we develop a mind shift? Is there nothing else that the obstetrician and gynecologist can engage in? I recognize we are different, but how to remain the king and queens of the jungle? Are we not adequate as technical providers doing capacity building, consultancies, mentors, apprenticeship, and researchers? Again, the lion, the ruler of the jungle, must also change tact, thinking very seriously about our mentality. So therefore, this informed my outline of this presentation. We need to give the context in globalization, legislature and the policy environment, human rights and gender equality, primary health coverage and universal health coverage, diversity, equity, social inclusivity and a sense of being, climate change and environmental pollutants, research, technology, and adapt to the changing role that the obstetrician and gynecologist must keep. We must remain calm, but again, we may have to rethink how to break that glass ceiling. And let us start with the legislative environment. Constitutional developments are founded on ratified international treaties and covenants. Please think for a moment. What are your national constitution aspects that you can hold duty bearers to account in women's health? Have you thought about that? However, is ratification all that is needed, or is it inadequate, requiring interpretation, domestication, implementation, monitoring, and tracking? When this is not upheld, as the gynecologist who is in charge of women's health, do you know where and the procedures to address your complaints nationally, and even as you move down to your various states and provinces and villages? Cascade of areas the obstetrician and gynecologist need therefore to focus on include, first and foremost, rethinking our leadership. What are the root causes of problems and barrier analysis and bottlenecks that we are going to face and continue to face? The resilience of countries and the funding for women's health. Are we creating programs fit for purpose or being renegated as useless? Which then pushes us into remembering we must strive to have evidence-based practices and service delivery modalities that are outside the norm. Ladies and gentlemen, we need to get out of our clinics. How many of us engage in mobile clinics? How many of us engage in the villages, the most rural part? How many of us do outreach services? How many of us participate in decentralized programs? We need to accelerate for some programmatic issues, e.g., gender-based violence, and I dare say in settings particularly with emergent diseases and humanitarian crisis. As an example, community engagement and mobilization, monitoring, evaluation, accountability, and learning. Do we participate in these forums? Knowing you're the pinnacle doctors, how many of you actually partake in advocacy? Participating in policy briefs that are context and priority specific for the regions you work in. Planning particularly for vulnerable and marginalized populations. partnerships. And in this case, I'm not looking at the partnership between obstetricians and gynecologists alone, but extending that intersectionality to include nurses, agriculturalists, economists. These are things that actually then give you a more holistic approach in women's health. And even moving into computer programming and technology engagement in your practices. Moving from basic care, preventive services, and health promotion that speak to primary health care, and extending beyond curative that we so well know into rehabilitative and palliative care. So with the leadership, what do I think of? You need to be visionary, and visionary to the point of where you see women's health as pertinent to development. But in thinking leadership, you must remember there is the micro environment, the immediate environment you work in. There is the meso environment, possibly of the institution you work for or with. And you have the macro environment extending to the communities that we do serve. And you have the mega environment, which then speaks to legislature and policy. We need to be part of that ecosystem, even beyond the nation, to regional and global platforms. We need to move our pinnacle, not just be that technical expert. Remembering no one should be left behind in your country or region or globally, and particularly in low middle income countries where the global picture is still wanting. Reimagine your role. And this is what actually makes me talk about stepping out, seeing not just that patient with a disease entity we are used to as the obstetrician and gynecologist, but looking holistically at women's health. I like relating it particularly to animal health. You had the oration with breech. How many of you participate in breech delivery, not just of human beings, but even of animal kind? How many of you have moved your artificial insemination from human medicine into animal medicine? How many of you participate in plant grafting and therefore addressing epigenetics and the biodiversification of women within the environment they live and work in? And again, speaking to environment, how have you looked at climate change and environmental degradation in relation to women's health? We need to dare to dream big, but not just dreaming, it's actually the reality for women today. Innovations. Can we put our collective together and develop frameworks that we can therefore operate in? Reskilling and upskilling. Yes, a lot of you may have done subspecializations, but when I talk of reskilling, how many of you have even gone to do some computer programming, even a bare minimum, the Python, the AI, the machine learning, and even if you don't know the technocratic parts of it, at least having a foundation basis so that you're able to articulate with the young and restless what we know as the alpha generation of today. I want to specifically call out to the women in the audience and challenge each one of you to take on leadership and have the men as allies. The reason I'm very pertinent about this is knowing you bring in a professional arm as an obstetrician and gynecologist, but you are a mother, you're a grandmother, you're an auntie, you're a sister. Who else knows what really is best for women? But let's go to globalization, and what do I think of when I think about? We are already in a global village, and this Zoom call attests to it. The recording is being done in Kenya. I am currently in Burkina Faso, but I'm speaking to you in the Asian continent. How much closer can the world be getting? Transport and digitalization As I flew to Burkina Faso, I actually said, distances are not as far away as we used to perceive them. They're getting closer and closer with a robust transportation system. And even if we're not transported physically, the digital world has changed things, and particularly after COVID, and giving us abilities to have access, opportunity for learning, knowledge sharing, and the art of even doing surgery through robotics, bridging what previously was seen as insurmountable. North to south dictum. For the longest, the northern and high income countries have brought advancement into low middle income countries. The question is, now there's a lot of agitation on decolonizing and moving to south collaborations and every endeavor to reach the last mile. Population demographics and migration in the quest of better livelihood and education. We have a very robust diaspora populace that is well educated. My question still behoves, where are they when it comes to our development in our nations? Legislature and policy environment is taking a more uniformed and standardized approach. And I'll give a few examples of these. The Sustainable Development Goals as a development agenda is global. Human Development Index, HIV-free generation, 0 rating preventable maternal deaths, 0 rating harmful cultural practices, 0 rating unmet need for family planning. These are just a few of the directions and the targets that have been set globally, which we all seemingly are benchmarking against. Global strategy frameworks and targets. You have the Global AIDS HIV strategy, End Equalities and End AIDS 2021-2026. Global strategy for ending cervical cancer. And here we talk about the 90-70-90-90. 90% fully vaccination, 70% being screened with high performance tests, 90% identified and treated, both for cancer and precancerous lesions, as examples. Then we have the global strategy for women, children, and adolescents, 2016 to 2030, where all should survive, should thrive, and we should transform their health. Global strategy for reducing unmet need of family planning, even by UNFPA, that talks of expanding choices and ensuring rights. As gynecologists, how many of us have actually put this as core to your practice and not just provision of services? There is therefore need to even recognize emerging diseases. Communicable and non-communicable diseases are still with us, compounding women and intergenerational health. Therefore, global action plans are very clear. We need to engage, we need to align, we need to accelerate, and we need to be accountable. I will repeat the issue on primary health care and universal health coverage. We are in LMICs. Majority of our patients cannot possibly afford curative medicine, and it therefore behoves we look further upstream, provision of preventive strategies and health promotion, more than curative services, rehabilitative and palliative. But in doing this, we must make sure that they are not financially denuded. We have access, effective coverage, quality of care, functional referrals. We must reach the last mile. We must be accountable, and particularly addressing our responsiveness to their preferences and needs, and adherence to diversity, inclusivity, and equitable devices, products, and services. I want to bring up the global strategy for women, children, and adolescent health. You may not be aware of this, but it is so clear the pillars that belong thereof. Country leadership, individual potential, humanitarian and fragile settings we must be cognizant of. Financing for health, and particularly in this era where we're all coming from the obstacle of COVID and other emergent diseases that have really pushed the socioeconomic framework globally into disarray. What and how are we participating as the gynecologist to make sure patients are not denuded and programs continue to run? Community engagement, research and innovation, health system resilience, multi-sector action, and accountability. I keep repeating the word accountability, but let me break it down a little bit further. It speaks to you being aware with your duty bearers on the policy environment for women's health, sexual, reproductive health, and rights. This is critical. Beyond that, it speaks very clearly of having a framework where you even know what are the finances devoted in this docket and the expenditures thereof. It is critical we play a part. But most importantly, you, as the service provider, are you accountable for the kind of works you do on your patients? Coming to the program level, I want to just go to the main pillars. In programmatic work, whether it's a family planning, maternal health, child health, or it is an oncology program, advocacy and dialogue, are you in that conversation? Are you at the table? Knowledge management, in other words, pushing evidence agenda right to the forefront for best practices and innovations. Capacity development of both the subspecialists and carrying the next generation with sound knowledge. Service delivery and the different arms in which you can deliver, making sure nobody is left behind. But more importantly, coordination. Coordination within your programs, partnerships, South-to-South collaboration, and triangulating this cooperation. Specifically, let's take one program in mind. And here I want to address ourselves to issues around postpartum hemorrhage as an example. What do you have in the journey tracker? I have learned these lessons from the path tracker. And this is what you need to look at if we look at the top. Global guidelines and market availability. Do you have the WHO guidelines? Do you have the global partnerships? And have you delineated out, or has WHO even guided you further on who you can actually affiliate with in terms of manufacturing? Then the national policies that adopt these WHO guidelines, and where they're not WHO guidelines, we also have the FIGO guidelines and guidance. Have you partaken into being part of the regulatory body or policy adaptation or integration into the existing policies? Developed your clinical guidelines? Have you ensured, particularly with the upcoming drugs like heat-stable carbetocin, tranexamic acid, inclusivity into your essential medical list? Stakeholder engagement. Is it still just the obstetrician? Have you involved the midwife, who's the frontline provider? Have you involved the communities that are the consumers of services for prevention and management of postpartum hemorrhage? Do you communicate with your duty bearers? Have you even done costed implementation planning? And therefore, very clear about the government budget lines or the county budget line. System integration and readiness. Commodity procurement specifications. Are you at that table? County and health management systems. Relevant indicators. Let me ask, do we only just track maternal mortality from postpartum hemorrhage? Do we look at things like near miss? Do we look at percentage coverage of heat stable carbetocin or tranexamic availability? I don't know, but we need to be where we're needed most, knowing we must remain as the lions and lionesses that roar. Are you part of the training curriculum, both for undergraduate and postgraduates? And in-service updates, continuous professional development, or continuous medical education? Are you an implementer of service delivery and therefore know about guideline dissemination, sub-national level dissemination, implementation, and with quality being ensured and equity being ensured? Is the data being entered appropriately so that you can make research and evidence-based synthesis of where other gaps are arising or where gains are being made? Healthcare worker implementation training, routine mentorship, and demand generation from communities, availability and job aids. And lastly, effective coverage. It's one thing talking about the care bundles when you speak to postpartum hemorrhage management, and particularly when you are addressing refractory postpartum care. But is it being orchestrated appropriately or inappropriate? Is it in a timely fashion or is it still wanting? Where are you? As an observer, as a practitioner, and as a leader, we need to address this. Because at the end of the day, what do we want to see? And I want to start with the bottom of this slide. You have a population with needs and expectations. Nobody wants a poor health outcome, particularly a pregnant woman. She wants to remain healthy. She wants a healthy baby. Governance, platforms, workforce, and the tools of trade. Learning and improvement must be a continuum. As you make outcomes, you're also really re-looking through to see that there is a cyclical repeat, to see that we're constantly improving all the time, the Kaizen rule. So the processes of care, competences of care and systems, and the quality of impact, which then gives us confidence with the system and provides economic benefit. But let's turn a little bit and look at human rights and gender equality. And sometimes I wonder, do we think in the context of our women and their pregnancies that we could be missing something? We're just treating mechanically somebody with not a disease, but with a condition. It may be temporary, but do we actually actualize the gender issues? And are we therefore transformative, where I can confidently say the men are walking with us during this period, moving from being gender blind to gender transformative, and pushing this agenda not just to the bedside, but to engage it in policy, in budget, in politics, in economics, in culture? I'm speaking to the gentlemen here. How many of you have taken it upon yourself that I shall be that feminist to make sure no woman deserves to die? No one should be left behind. Accountability and transparency. But again, we have the issue of gender as practitioners. Even amongst the women, I, as an example, have to climb so many barriers. And all we ever ask is see me through the lens of merit and not the fact that I am a woman. This then brings on even issues around patient rights charter. But again, we are in a field where we're also challenged And it has reached a point where institutional defense of frontline workers in sexual reproductive health and rights is wanted. So, what is your institutionalized work culture? Do we adhere to legal context, professionalism, ethical practice, scope of practice, labor and occupational laws? And are we conducting this with universality, which would then have implications on the quality and safety of the care we provide and a sense of clinicians' health and well-being as we execute our duties? Again, where are we as the gynecologist in clinical rights charter and clinician ombudsman, gender mainstreaming, and advocacy that acknowledges the workplace and the health workforce diversity? Accountability, accountability. What is the role now of you as an individual and your professional bodies in the defense of even healthcare workers? Examples that I want us to reflect on that do give us some of these challenges that we are seeing. When we speak of safe abortion and post-abortion care, HIV and AIDS services and other communicable diseases, the LGBTQIA community, adolescent and youth services, family planning, mental health. We have seen clinicians who have been detained and arrested, who have had legal litigation, physically attacked or harassed, raids and break-in of facilities, smear campaigns, torture and ill treatment, and in the unfortunate circumstances, some clinicians have even died. We can no longer sit at the periphery. We must defend our own. We will speak a bit on research. And I want to reflect on research with two arms. Oftenly, it is novel. You have an idea, a eureka moment, and you want to figure out if that eureka intervention or innovation would work. And sometimes we're just addressing the gap. There is what is the target, there is where we reach, and what is it that is failing to give you that bridging of the gap. Research can be done in various ways, and I will not go into the methodologies of research, but rather I want to look at the gap and barrier assessments, oftenly which we don't seem to do. We commonly look at the root cause analysis or the fishbone analysis. That's very common. But we don't seem to do mind mapping, the nonlinear graphic representation of brainstorming, SWOT analysis, and PESTELE. Most of the time you will do this when you're doing policy-related documents. But this should be a norm, even for us in programs, re-looking at what works and what needs to be relooked at. Then we have failure mode and effects analysis. And this usually is used to identify problems or failure models at the various stages within projects. Conducting gradual evaluation of causes and effects and corresponding preventive measures. Changing our programming. Most of the time, we have had siloed programs. And I must say, I find it very interesting when I move around with gynecologists. I'm a maternal fetal medicine specialist. I am an oncologist. I am an infertility specialist. I am a life science specialist. I'm an adolescent specialist. Where is the interface? Yes, FIGO is trying to make a difference, even within the scientific committees where we are saying intercollaborate, because again, it is the same one woman. Now, I'm not only saying intercollaborate, let us extend even to other fields. So we have to have convergence and divergent thinking. This is what is known as a systemic thinker. Logic versus creative thinking will always create motives and creative pictures and address things with a more holistic approach. but we're also saying you'll even notice the valuing of people and cultivation of interpersonal relationships. Where is the world going? Even to the Internet of Things and the meta phase, the big data. We're no longer looking at single programmatic data. We're cross-secting and even looking at indices that will affect maternal health. I will give one example. When you look at multi-dimensional causes of poverty, there is an indice that looks at child health, that looks at education, and that looks at living standard. These are all factors that are integral even as we speak and articulate women's health. Nutrition. With reproductive, maternal, newborn, child, and adolescent health. Have you thought about it? But I have. Nutrition for posterity. The next generation matters. Prosperity. Just imagine that child with poor physical development, poor cognitive development. Where does it start? Think nutrition. And the two put together is a development agenda globally. This is in FIGO. The World Health Organization reports 1 in 3 people around the world suffer from the effects of some form of malnutrition. And when we speak malnutrition, remember, it's undernourishment, the underweight, and it is overnourishment, the obesity. The non-communicable disease risk factors collaboration predicts by 2025, in the next 2 years, more than 21% of the women in the world will have obesity. We need to really rethink nutrition and the posterity, prosperity, and development. And this should take on a life course approach. We're not just looking at when the mother is planning to be pregnant. We're looking through her pregnancy and beyond that pregnancy, what has fetal programmed into the baby and then recyclicizes itself even into childhood and adolescenthood. It's a continuum. This you will be able to look at. And we're looking at both the macronutrient and the micronutrient environment that does exist. But let's look critically or think critically a little bit. We have what kills our mothers, the big 5, hemorrhage, commonly following anemia, hypertensive diseases in pregnancy. Is that not an NCD where it's chronically existent or persists chronically after, as the aftermath? Obstructed labor, poor bone development. What are we speaking of? Micronutrients. Abortions. What is making us lose our pregnancies? Is it anemia? Is it infections? Then we also have the problem that relates to puerperal sepsis. Again, is anemia at the top? Communicable diseases and other indirect causes? What's the role of nutrition in all of this? The same goes when we think of deaths for neonates and the under 5, when we talk of prematurity, when we talk of congenital anomalies, when we talk of neonatal sepsis, when we talk of pneumonias and malarias. Aren't we speaking nutrition in all of this? So maybe we need to have a rethink as gynecologists. What is our role with climate change and environment? And in so speaking, even One Health, and health in all policies. And in thinking this way, poverty and hunger are intricately interlinked and must be addressed as a development agenda through the socio-ecological lens, from the individual to interpersonal to organizational to the communities, and finally the policy environment I've already alluded to. Bringing up the concept of health in all policies. This, I think, we're all familiar with. At the bottom, the heat waves that are striking the gland. Can women till anything? On the extreme right, the drought and poor growth of food. And this speaks then to our thinking of hardier crops, biodiversity, short plant to production intervals. At the top left, we're looking at locusts and other infestations, armyworms, that are increasingly propagating themselves because of climate change. And then the flooding. I think all of us can attest to the floodings, the droughts, the heat waves, the ice glaciers that are even melting up in the north. Are we, as gynecologists, part of that conversation? Or do we just imagine addressing the health of women as we know it? I want you to remember, when food is scarce, the people who suffer most are women and children. And conflicts tend to even become more pronounced because of lack of a basic need. And where food is scarce, again, there may be problems with other natural resources like water, clean air, and soil that can be used for planting crops. So this is what happens. Mothers under normal conditions, if you look at your extreme left, normal weight, balanced diet, healthy baby, babies that are appropriate for gestational age. But mothers who are underfed or mothers who are overfed, look at the extreme right. You have issues with the baby, ranging from small for gestational age up to large for gestational age. We're all familiar with this. But look at the adult consequence. High blood pressure, insulin resistance, increased adiposity, disease risk, fertility issues, metabolic syndrome, cardiovascular disease, and I even dare say cancers. We must address ourselves as gynecologists, and for our fetuses' sake, the next generation, protecting them from NCDs. Here I've just put up the interrelationship between nutrition, agriculture, our food systems, and meeting the challenge. Again, it just speaks to us looking at nutrition within a life course approach. Throughout the continuum, from when that little baby is nursing at the breast, to when that baby becomes the adolescent who begins to menstruate and needs to have macro and micronutrients really keenly looked at, because she will soon be in reproduction. Fetal programming must be addressed with urgency. But as we speak to climate change, we must also address environmental pollutants. Here I've depicted the various things that are getting polluted: the air we breathe, the water we consume, and the effluent that we release back into that natural resource, and the soil contaminants that do exist. Remembering, all these contaminants affect health in many ways: respiratory illness, cardiovascular illness, gastrointestinal illnesses, cancer risk. But for the woman, remember, we have endocrine disruption. So fertility-related issues and consequences thereof are increasingly being documented. And this again is FIGO. Climate change presents an imminent health risk to pregnant women, the developing fetus, and our reproductive health. The health impacts of our global climate crisis on maternal and child health can no longer be ignored. Global warming, the gradual heating of the Earth's surface, oceans, and atmosphere, is caused by human activity, primarily the burning of fossil fuels and release of carbon dioxide, methane, and other greenhouse gases into the atmosphere. Climate change is a better reflection of conditions because these changes are accompanied by storms, snowstorms, temperature increases, melting ice, changes in sea level, disruption of weather, and worsening of air quality. And worsened air quality, exposure to heat, and even population displacement. Discussions are on integral considerations in the climate crisis. Climate crisis needs to address these variables and the impact on health. So my question to you, ladies and gentlemen, how many of you participate in COP, the climate seminars or the climate discussions at the global level? How many of us are conducting research or documenting our evidence with what we see and have continued to see with use of herbicides, pesticides, elements in flower farms, as an example? Are we really talking the walk as the gynecologist? Adverse obstetric outcomes have been recorded, and we have seen in the mothers, preterm birth, low birth weight, and stillbirths. Amongst the neonates, you have neurodevelopmental delays, autism, spectrum disorders, cardiac defects. And these are not just limited to this age cadre. We have complications being seen in the entire life course: respiratory, cardiovascular, fertility, mental health. The risk to pregnant women and developing fetuses, however, pose the greatest risk to a global population health due to long-term impacts on current and future generations. Now let me move to technology. Imagine healthcare in 2050. Somebody said this: the healthcare industry is going to be commoditized, democratized, and consumerized. The study of the omics, basic life sciences, we've moved from cellular level to molecular level, which translates from structure, function, and dynamics of an organism, both to endogenous and exogenous factors, generated for better understanding of health and disease. Without being too complicated, COVID is a viremia. But where is it coming from? That's not even the issue. How is it propagating and adjusting and changing so that it is persistently in our environment? These are some of the things that the omics are talking to us about. Laboratories, therefore, should not be left behind as we delve into life sciences. Big data again, AI and machine learning moving in tandem. Artificial intelligence gives us different things. I will just mention a few: chatbots, natural language processing, neural networks, thought processes. These are just some of the AI issues you need to be cognitive of. When it comes to machine learning, it can be grossly divided into unsupervised learning, supervised learning, and reinforcement learning. Food for thought. I won't break it down, but I need you to look at this so that you also begin to comprehend what you need to be aware of as the gynecologist. Areas are already existent where people talking femtech, but all of us know after COVID came, the learning management system changed. Education and simulation skilling, information, education, and communication. Increasingly, we use the tech system. We are looking at prevention of diseases, prediction and screening, early diagnostic, life sciences that include even immunology and microbiomes, building resilience, the lessons from animal and plant industry to enhance human medicine, speaking again to the One Health and the new public health order, vaccines as an example, drug development, real-time data. We're no longer scribbling notes as we used to, but you can actually have it on a platform and generate your data and the analytics and a scoreboard or scorecard immediately at the end of even your working day. Big data bundling of products, health disparities and population sciences, risk stratification, early warnings, cancer care, data repositories are things that we must begin to seriously take into account as gynecologists. Technology-driven lifestyle modulators, precision medicine, and robotic surgery. I mean, the scope is as wide as we are, but are we in this space? So, technology utilization specific to women's health, screening with risk assessment, diagnostics, data, dialogue, and decision-making, service delivery modeling, advanced technology that's giving predictions and precision medicine, evidence synthesis and future research. Decision-making and priorities are becoming all the more robust for all of us. Commercialization and entrepreneurship. Wherever there'll be an innovation, the commercial arm is bound to pick up. Are you in that space? And you can see at the diagram below, wearable technologies that people are using and doing self-care or relaying the same to the health practitioner, either through telemedicine, teleconsults, or even an SMS or WhatsApp. But I have drawn in the middle a washroom, and I see an advent by 2050. All of us may not even need to move out of our washroom. That is where the biology sits. From the mouth swab, when you're brushing your teeth, to the urine that you produce, or to the stool that you produce, we will understand the human intricacies of science in this room. You will hold me to account in the next 10 years. So therefore, we go to innovations in healthcare, and we need to begin to look at the policy frameworks, population health, health system, economics, organizational, environmental system challenges, equity, and sustainability. At the bottom, I've just shown how you generate an innovation. Research and design, develop and validate a prototype, approve, and then move it to scale so that you can apply it with intention, conscious intention, the last mile first. But unfortunately, technologies are also giving us drawbacks. It is giving us a good way of creating and conceptualizing and strategizing. But the humane issues, empathy, emotional intelligence, problem solving, are outside the code or the algorithm. So ladies and gentlemen, having gone through this and having thought from the background at the beginning, I ask you a question. Where is your professional traffic light? Do you have much more to do individually and collectively as a society and also as part of FIGO fraternity? The more I thought about it, the more I thought too much needs to be done and remains undone. And finally, I want to go back where we started. We are the ruler of the jungle. You do not have to be great to start, but you have to start to be great again. Thank you very much. And I do hope this has opened your thinking and your mind as it did mine. Have a wonderful evening.
Yeah, thank you so much. And this was a phenomenal oration. So much insights and so much food to think for. It's really been a treat to listen to you and your thought process, and we really know what is in store for us when you become the FIGO president. Yvonne, I'd like to have some comments from you. Rohana and Professor Arul, all of you are there. I'd like some comments from all of you. Dr. Naren?
Arul.
Yeah, Arul.
It's a fascinating talk. It encompasses many facets, not only about individual society, but also the global.
Thank you so much. And I'll request Dr. Naren Malhotra, who is the organizer of this particular oration series, to have his comments. And I'll also like to request Dr. Rohana to comment.
No, we will request Dr. Arul Kumaran to comment, please. I mean, this
He's
is one of the
commented.
finest lecture he's commented. I was there. So, sir, welcome, sir. Thank you for being here. This is one of the finest lectures I've ever heard on the changing trends in OBGYN. You get an insight of what we are, what we were, and what is going to happen tomorrow with AI and Chat GPT. Chat GPT and AI will not replace us, but it's going to be very helpful to us if we learn how to use. So probably the next couple of webinars, I'm going to try to plan on Chat GPT and AI and how to use it in our daily practice for the obstetrician. So thank you, and Chiara, for this fantastic deliberation. And we invite any other comments from anyone who's there.
Dr. Rohana, if you're there. So I think we like to end this session with a big thank you to Anne for all the effort she made, in spite of her very hectic traveling schedule, to accommodate SAFOG for this fantastic oration. Thank you so much for each and every one of you who are there on this platform and on the other platforms to be here attending this fantastic oration. Thank you again. Thank you, Prof. Arul.